perimenopause and menopause and fat storage versus fat burning or fat loss. Hi, everyone. I'm Dr. Kristi Tompkins, and for over 15 years, I have been specializing in women's health, women's hormone conditions from adolescence to menopause and beyond, specifically in the areas of perimenopause and menopause. And today I want to talk about something really important that comes up a lot in conversation, in concern with a lot of my female clients. So with regard to perimenopause and menopause, and I know I'm grouping those two, I don't want to call them conditions, but phases of life into one, they are distinctly different with regard to your body's ability or your body's direction towards fat burning versus fat storing. So let's focus on perimenopause for this video today. So a lot of women, as they enter the perimenopausal years, and generally speaking, that's between the ages of 35 and 55 for most women, a lot of women start to notice that in addition to a lot of other hormone change conditions, such as changes in their period, changes in bleeding, changes in the timing or the cycle of their periods, changes in PMS symptoms, the pain of the menstrual cramps, and a whole assortment of other physical changes, mood changes, anxiety, mood swings, depression, sleep interruption, etc. In addition to all of that, a lot of women complain, I'm storing a lot more body fat around my midsection, belly fat, abdominal fat, when they are claiming, and I'd love to believe them, I'd like to believe them, when they say nothing has changed. My diet hasn't changed, my exercise hasn't changed, nothing has drastically changed, except for I'm storing a lot more fat around the midsection. And I want to dissect this a little bit deeper as to some of the possible causes for why this might be happening. And keep in mind, this is going to be a case-by-case individual basis. So not every woman is going to necessarily gain body fat or an excessive amount in their midsection, but I would say this is a very common symptom or direct effect of perimenopause, and of course menopause as well. Menopause is when your periods have stopped completely for 12 months or longer and they're not coming back. So let's assume you are a woman who is having a period, you're in your perimenopausal years, you're having a period every month, most months, and now you're starting to notice changes in body fat distribution. One of the main causes for that is estrogen or estradiol. We have lots of different types of estrogens actually that are produced by our ovaries. That estrogen starts to drop a bit. It starts to drop, I would say, for a lot of women, late 30s, it might be 40s. I would say the majority of women start to notice changes in estrogen in their late 40s and early 50s. So when estrogen starts to drop, estrogen is one of those hormones that helps with evenly distributing fat throughout the body. So fat distribution throughout the body, the belly, the hips, the thighs, the buttocks, chest fat, arm. And typically women that are younger, reproductive fertile years, they have a lot more estrogen. We have a lot more estrogen, and therefore the fat is more evenly distributed. During perimenopause, as estrogen starts to drop, the fat distribution starts to change to the midsection. So estrogen drops, and now everything that, because of this hormonal dip, there's a hormonal shift to store more body fat in the belly. And a lot of times this can be exacerbated by several different factors, and I'll go over those. I'll go over those here with you today. So with estrogen starting to now drop, now a little bit more body fat has shifted to the midsection. What can often happen in addition to that is there might also be a drop in muscle mass. Now, muscle mass has a lot to do with your activity level, what types of exercises you're doing, what types of muscle strengthening exercises if you are, hopefully you are, if you're not, that would be a big recommendation to implement that into your exercise. With muscle mass starting to drop, the greater body mass index, or the greater amount of muscle mass that you have on your body, not to the degree that men have, but more muscle strength, muscle mass for your body, muscle actually helps with increasing metabolic rate and therefore fat burning. It doesn't necessarily make you bulky, but the stronger your muscles are, the more you work your muscles consistently from head to toe, your metabolic rate goes up. And so that is a high plug-in or recommendation or heavy suggestion for you to implement muscle strengthening using your own body weight, using dumbbells, using barbells, using different types of machines at a gym, if that's your choice of exercise, to build that, especially during the perimenopause and menopausal years and beyond. And so with estrogen dropping, more fat is distributed here. So one recommendation would be to implement muscle strengthening exercises to help with the fat burning, and not so much doing a ton of crunches or doing a lot of ab workouts. You really want to work all of your muscles from your entire body. So another thing that might be happening is, and that could also, I just want to back up a little bit, with muscle mass dropping, that could also be related to testosterone, another one of our sex steroid hormones, that it often drops. It often drops for women in their, again, this is going to vary. Testosterone is going to be, what's the word I'm looking for? It's going to be balanced at a level that's right for your body. And for some women, they might notice in their 30s it's starting to drop. So testosterone can drop related to just the hormone changes, but it can also drop from other things like stress, life stressors, and that can also cause testosterone to drop. So as testosterone drops, your muscle mass might also be starting to drop too. The interesting thing about muscle strengthening is that can have a slight boosting effect on testosterone in the body as well. So backing up here to another cause for increased belly fat would be insulin sensitivity is not as sensitive. So insulin is one of our hormones that's produced by the pancreas in response to any kind of carbohydrates or fat coming into the body through your diet. And if the insulin is not as sensitive, or if your body is not as sensitive to the insulin, meaning the glucose, the carbohydrates that you're ingesting or the fat that you're ingesting is not getting metabolized and used as fuel, your body will store that. So insulin becomes less sensitive in your body, and that can cause your body to store more body fat, even though you might not necessarily be changing the caloric intake of carbohydrates and fat. Another thing that might be happening is, I mentioned stress just a little bit ago. So with stress, your body, and stress comes in many different ways. It could be life stressors, day-to-day stress of your job, finances, relationships, kids. If you have parents that you're caring for, catastrophes, emotional stress, things that we're worrying about that maybe haven't happened, maybe they're not going to happen at all. Worrying about things from the past that maybe are no longer relevant to our life, but we're still ruminating over it. Any kind of stressor to the body that can cause more cortisol, and then more cortisol causes more blood sugar to be released, or blood glucose, and that causes more insulin, and then now that can get stored in the body. So all of that creates that perfect storm for more storage, especially around the belly area. There's also stress around your health. There could be stress around, my hormones are changing and everything's out of whack now, and I feel out of balance, and things don't feel the same that they used to, or now I'm gaining weight and I'm stressed over that because now I can't fit into my clothes, or my pants are too tight, or I used to be able to fit into this cute dress and now I can't. And so that causes emotional distress for a lot of women, and that can lead to increased cortisol in the body, and then therefore more fat storage. And so one of the things that can also happen is women, because of hormone changes, estrogen is dropping, progesterone, another one of our sex steroid hormones, is dropping. That causes interrupted sleep. So that deep, heavy sleep that you used to get as a teenager, in your 20s, potentially in your 30s as well, that's not quite as common, unfortunately, for a lot of women in their 40s and 50s and beyond. So because those hormones play a heavy role in neurotransmitter production and deeper sleep, that interrupted sleep causes more cortisol, and then that then could potentially cause more erratic blood sugar swings the next day, erratic adrenal function throughout the day, and craving more carbohydrates because you didn't get a lot of sleep. And then now your hormones are dropping, and the hormones dropping can also cause more carbohydrate craving. And because of all of that interrupted sleep or the insomnia and potentially all those other triggers, that can also lead to increased body fat around the body, or around the midsection. So this is going to vary, as I mentioned at the very beginning, from woman to woman. And one of the best things that you can do during this phase of your life is really come at this from an angle or a position of, I'm going to do what I can to meet my body where it's at, wherever it is, whatever age or whatever phase of perimenopause I am. And a lot of times it's hard for women to tell, am I in perimenopause, or is this happening because of hormone changes? Is this happening because of something else, because of stress? Maybe I'm gaining weight because I am simply eating more, or I'm traveling more, or I'm under a lot of pressure from work, or there's something going on in my personal life with my relationships, and I'm therefore eating more and I'm not exercising as much. So that could be a piece of it too, regardless, or not related to perimenopause. But a lot of times those are grouped together, especially if you're in your early 40s, late 30s, early 40s, and early 50s. So with regard to adaptation and resiliency, this is that time of your life where it becomes important to really meet your body where it's at. So if you're starting to notice more body fat storage and you haven't changed a whole lot, but you're noticing things are shifting in your body, hormonally, with regard to your menstrual cycle and the body fat distribution, this is the perfect time to start to put better quality carbohydrates into your body. And when I say better quality, usually in the form of vegetables, some fruits, minimizing the refined carbohydrates, the sugars, the processed foods, the crackers, the cookies, the pastries, the pasta, things like that, reducing those. Making sure that you're getting high quality, essential protein with all the essential amino acids in your body. So enough protein, enough of the right kind of essential fatty acids. So making sure that those macronutrients, the carbs, the fats, and the proteins, are in a balance that's right for your body. And I'm not going to get into specific percentages because I think that's going to vary from woman to woman. So making sure you're having a lot of those. And typically, if you're having a balanced macronutrient diet, a lot of times you're usually getting the micronutrients, the vitamins, the minerals, the antioxidants. And that usually tends to be very nourishing and replenishing for the body. With regard to exercise, as I mentioned, making sure that you are implementing muscle strengthening using your own body, Pilates, yoga, just simply doing lunges and squats and push-ups and things like that. It doesn't have to be barbells. It doesn't have to be weights. You don't have to join a gym. You do you do what you love. If it's swimming, if it's walking, if it's doing bar classes, whatever it is you love to do that, but make sure that you are strengthening your muscles to the point where they're kind of tender the next day, not injured, but you want them to be sore, and that's when you know you've fatigued or challenged your muscles. And that usually means that your metabolic rate is starting to climb, which means you're going to start burning fat. One thing I want to mention too that I haven't yet is something called intermittent fasting. Intermittent fasting is something that you can implement to help with fat loss. So, not snacking all the time, but choosing. A lot of times we have this habit of eating our meals, but then also snacking in between meals. And that basically gives us this flood of energy or flood of calories, and if we are perimenopausal and things have shifted and now we're storing more fat, that just makes it worse. So engaging in intermittent fasting, whether it's doing 11 to 8 ratio where you're not eating after a certain time before you go to bed, where you, let's say your last meal of the day is at 6 o'clock or 7 o'clock, you're not eating until maybe 10 o'clock or 11 o'clock or noon the next day. You get to choose those days, how many days a week you want to engage in that, whether it's every day or 2 to 3 days a week, or some people like to have a meal maybe 7 or 8, but now their next meal is not until noon or 1 o'clock. So again, the intermittent fasting, what that does is it also helps with longevity. It helps with calorie burning, fat burning. It helps with it actually helps support mitochondrial function. It helps with mental clarity, assuming your blood sugar isn't dropping too low. Because if it drops too low, then you're going to have brain fog and you're not going to be able to focus because your body isn't getting the nutrients that it needs. So this is where it becomes important or critical to talk with a functional medicine, naturopathic doctor, somebody that is focused on or specializes in women's health and hormones, perimenopause, menopause, who knows what kind of guidance and recommendations and knows clinically what commonly happens with a lot of women and knows what questions to ask for, knows which lab tests to order, knows what kind of diets, exercise programs, supplements, which I haven't talked about, bioidentical hormone prescriptions, somebody that can give you a tailored, personalized plan, treatment protocol that's best for you. Because I will tell you, in the 15 plus years that I have been in clinical practice, no two women are alike with regard to what diet works for them, what exercise, what supplements, what bioidentical hormone prescriptions. Every woman is very unique in every way, but especially when it comes to this time in your life. And so making sure that you can talk to somebody or work with somebody who is a professional, who knows what they're talking about and has a lot of seasoned experience in this, that can give you the right guided treatment plan, a tailored plan that's right for you. And so that is it for today. I want to make sure that you have this information because I think it's so important. And it's again, one of the more common reactions or symptoms that I hear from a lot of my perimenopause and menopausal clients is that shift in body fat. So there are ways to alleviate that. There are ways to even completely reverse that in some cases, but you do have to work with your body and where it's at. Compassion is a big key word here. It's a big recommendation because as your body's going through changes, you can't just make those changes that you made back when you were in your 20s or even your 30s, because the body often doesn't change that quickly. It really has a lot to do with having more compassion and patience and adaptability with your body and knowing that it will change. You just have to make sure that you're giving it the right guidance and the right resources as much as you can.